sudden chaos, endless confusion, and people's health on the line. When it comes to the rollout of the latest COVID-19 booster shots under Robert F. Kennedy Jr.'s watch, it's hard not to wonder, is the turbulence accidental or by design? Here's the inside story of a public health system under immense pressure, and the mounting frustrations of everyday Americans trying to keep themselves and their families safe. Right from the outset, the Biden administration's first release of updated COVID boosters has been engulfed in a swirl of obstacles. Difficulties accessing vaccines, conflicting eligibility information, insurance headaches, and a wave of misinformation running rampant among healthcare providers. Millions are trying to navigate a system that even health experts describe as bewildering. Consider the basic act of seeking a vaccine. Americans across the country have encountered a gauntlet of red tape. Many are confused about whether they qualify, run into roadblocks while booking appointments, and are sometimes misled by both medical staff and their own doctors. These problems don't hit everyone equally. Health professionals stress that people of color and those from lower-income communities bear the brunt of these challenges, facing greater barriers and often a lack of support. But here's where it gets controversial. The confusion isn't just a side effect. It's happening against a backdrop of internal strife at the top levels of U.S. health agencies. Several senior figures at the Centers for Disease Control and Prevention, CDC, have resigned, reportedly due to intense pressure to adopt less scientific vaccine policies and fresh limitations placed on who can receive the new doses. At a Senate committee hearing, RFK Jr., now the Secretary of Health and Human Services, made a statement that only deepened the uncertainty. Anybody can get the booster, he declared, swiftly adding that it's not recommended for healthy people. In a separate social media post, he even suggested that only high-risk individuals should get the updated shot. These mixed messages left both the public and health professionals scrambling to interpret fast-changing guidelines. Take Matt Shipman, a health writer from North Carolina, who was motivated by concern over both immediate and lingering complications from COVID, especially as cases surged late in the summer. Once, arranging a booster was as easy as scheduling an online appointment at the local pharmacy. Now, Shipman was told shots might arrive in several weeks. When he reached out to his doctor's office for a prescription, he wasn't even offered an appointment. Why the new prescription requirement? In several states, pharmacies won't provide any booster unless you present a prescription, a hurdle especially acute when local laws restrict providers from administering vaccines not officially recommended by the CDC's Advisory Panel, ACIP. For doctors, using COVID vaccines is still covered under emergency federal protections. But pharmacists, unless the shot is fully endorsed, face more legal uncertainty. Not to mention, insurance companies may refuse to pay for boosters until official recommendations are finalized. Now, here's the part most people miss. Even the committees assigned to clarify guidelines are mired in controversy and political maneuvering. The next ACIP meeting, meant to settle these recommendations, has been delayed amid accusations of politicization, most notably by Senator Bill Cassidy, who demanded a pause while the CDC reorients itself after recent resignations. Shipman summed up public sentiment. It's beyond frustrating. This isn't just inconvenient. It could seriously endanger people's health, even cost lives. This is a completely avoidable crisis. Legal experts, such as UCLA's Professor Lindsay Wiley, point out that some states are rushing to fix the chaos, governors and health authorities issuing workarounds, while other states remain stalled, waiting on legislative action. Even states like Maryland, with proactive policies, such as advising pharmacies to vaccinate everyone. No questions asked. See implementation gaps. For instance, Ian Morgan in Maryland was told by a pharmacist he was ineligible because he didn't fit the over 65 or high-risk criteria. Online appointment systems echoed that exclusion. Morgan, a postdoctoral fellow at the NIH and union representative, describes Kennedy's unpredictable vaccine messaging as the source of ongoing turmoil. It genuinely seems like the confusion is the goal, not an accident. This constant undermining of researchers and experts is doing real harm, he argued. Morgan is among 1,000 HHS and ex-HHS employees demanding Kennedy's resignation. And this is where the controversy takes center stage. Could some policymakers be intentionally sowing doubt for political leverage? That's a question many are now openly asking. For families with young children, the battle is even harder. Pediatricians find the new booster rules especially murky and fear legal liability if they misinterpret state or federal policy. In Minnesota, retired Dr. Joanne Hilden spent weeks searching for doses for her grandkids, only to find the county health office is limiting shots to seniors, while pharmacies still await delivery of children's versions. The issues go deeper than bureaucracy. Professor Julia Lynch of the University of Pennsylvania highlighted entrenched unequal access. When she tried to get vaccinated in New Jersey, appointments were open in largely white suburban Oakland, an area 80% white, but unavailable in nearby Camden, with a population that's mostly Black and Latino. Complicating matters further is the challenge of transportation. In Lynch's case, a public transit trip alone would have taken over 2 hours and required multiple bus and train transfers, a journey unthinkable for those at high risk or those with mobility and financial limitations. Those most in need, older adults or those with medical conditions, are often exactly the people least able to surmount these logistical mountains. Many lack reliable internet to book appointments, can't afford to miss work, or have no one to look after children. But anyone not glued to the internet, the whole process is a Herculean task, Lynch said, noting that for the uninsured, high out-of-pocket costs make matters worse. Rachel, a Pittsburgh resident, using only her first name for privacy, lives with 2 autoimmune diseases and a genetic clotting disorder. She'd like the booster, but is anxiously holding off. Right now, it's all about whether the information out there is accurate, and what will actually happen if I try to get one, she explained. Friends had been denied shots at local pharmacies even after Pennsylvania announced broader availability. Her verdict? It's still a mess. Based on no meaningful medical evidence, sometimes even flat-out lies, they've decided to ration these vaccines as if they're dangerous. It's beyond frustrating. In New York, Sarah, also alias for privacy, finally received her shot after days of chasing paperwork and switching pharmacies. Initially, a prescription was required. Then state leadership stepped in and opened eligibility. Even so, her first attempt at a prescription was thwarted by technical hurdles. And the pharmacy only had Moderna, not Pfizer. After finally securing a vaccine, she had to pay $250 up front and spent hours fighting with her insurer for reimbursement. And if that wasn't enough, the pharmacist tried to talk her out of the shot. Do you really know what you're getting into? This is so new. Sarah, adamant, replied, "That's why I want the